Hello everyone and welcome to today's SIA webinar. Today's discussion is on form research to best practice in workplace health and wellbeing. We are pleased to welcome our presenter for today, James Mills. This webinar is live and interactive. You are encouraged to post questions to the presenter throughout the presentation. If you are experiencing any technical issues during the webinar, please dial our support team on 1800-733-16. This number is also listed in the chat box. I'd now like to pass you over to James.
Thanks for that, Bianca, and thanks for everyone for tuning in. James Mills is my name, Director of Operations at OzHelp Foundation. It's a real privilege to be able to interact with colleagues of similar commitment, and I really believe there's a power in sharing with each other what we learn. And thank the SIA for the opportunity. The SIA are a national delivery partner, one of our programs, which you might hear about during the presentation. And so thank them for the opportunity. Today we're looking at best practice in employee health and wellbeing. So it's important for me to always relate back to the practical, and I'll do this throughout the presentation. I feel there's often a gap between hearing about best practice and then overcoming the practical challenges within our workplaces, or in my case, our clients' workplaces, and their challenges just being able to implement stuff. So with regard to questions, I'll just a little bit of housekeeping. As Bianca said, or I'll encourage you to ask them, and I'll try to answer them on the run. Just type them in the chat box there. I might flag them though if I think they'll be covered later on, and I'll welcome you reaching out to have a more in-depth discussion. I'll put some details up for you to reach out, and if you want to clarify any resources or anything like that. So, I've identified some goals for today and a structure to get us there. And firstly, I'd really like to be able, at the end of this, for you to be able to identify the key elements of best practice. We do this through a summation of the literature in the area, because it is quite a lot of it. We also do it by relating back to case studies that I believe exemplify the key elements to come out of as a theme, as themes in the research. So you'll see, I think you'll see very clear trends appear as we look at the different bodies of research. So just to make the point that this is a complex area with regard to research, because when we're talking about employee health and wellbeing within workplaces, we're actually talking about a multitude of areas. So human behaviour, changes, change in general, workplace practices, workplace structures, culture, they're huge areas within themselves. Evaluation of wellbeing programs in general, through to individual activity and individual trainings. So there's evidence-based and research around all that stuff, and also general health and general health research, general health issues, right through to legislation. So that's why you see activity in this area from diverse areas. So you see HR, you see safety people, I'm assuming a lot of you are in that boat, but you also see management consultants following up, talking about the space. So at first I was a bit like, what, is that just I was a bit cynical, a route to market, but actually it is in that realm, and that'll come out in the presentation. So I hope to give you a model, really simple filters to view your workplace activity currently and where you're at. And I mean really simple, just to assess on a continuum of how you might just improve just that little bit without necessarily, if you can't necessarily get through to the absolute best practice, then small improvements will help help along the way. As I said, we'll look at the backbone of it will be a case study, and I'll just touch on the big E. I call it engagement. So there's a lot of activity out there, sometimes falls flat. So just I'll address that all along the way. And finally, I'll just touch on the power of data and give you a couple of examples of how data has built a business case to get resources for people in your positions and to get health and well-being a seat at the table, if you like, in the same way that safety went many years ago. I think we're progressing on a journey where health and well-being will become more and more embedded in management decisions. So just my story, to give you an idea of why I do this. I come to this work firsthand. I've seen the importance of the workplace in people's health and well-being, positive and negative. So I approached an organisation called OzHelp, an organisation that was focused on suicide prevention through workplace intervention. So I had a very personal connection there. And OzHelp's been around for 15 years. It was formed after a series of suicides in the construction industry. It's now operating nationally, and it's evolved to include the learnings over the 15 years, consulting in the design and implementation of workplace health and wellbeing programs, and importantly, also provides the practical tools, which, as I mentioned, is a really important thing for me. Not an academic. I like to see things in practice and working. So the gap I referred to before was between knowing what the research says is present in best practice and having the actual tools and programs to achieve. And that's where I see OzHelp programs fitting in. That's why I wanted to work here. So, and it also to empower you to look after your people. So some of OzHelp's programs are referred to here via the case study. The reason for that's quite simple. The best practice principles that we're exploring here have been the same basis for our program development. So when I'm looking for examples to show you of certain things, that's a natural place that I can draw from. So so that's why I choose to spend my working life in this area. It's because I believe it can make a tangible difference and positive difference in people's lives and to business and to society. So it's a real privilege to work for an organisation like OzHelp. So what I'm going to do is kick off with a case study, so you'll be able to refer back to that when we get into the literature review and evidence. So I'll run through. The case study comes from a construction company, a large site-based projects construction company. Don't worry too much if that's not your area. Please don't switch off because, as I said, the learnings are universal. So traditionally, this is the hardest to reach demographic, male, blue collar, isolated. So I thought it might be a good example. And now, the groundwork, if you like, for this case study, it didn't start from nothing. It brought together years of activity, and I'll say that in inverted commas. You'll see why later, but there's a lot of activity, and it's about bringing that activity into a coordinated, measurable program. So it didn't start from nothing. So if you look at this and say that is not possible in my workplace, for example, that's okay. You can still get something out of it. So leadership, the first part of the groundwork beyond that was that the leadership identified health and wellbeing as a critical risk. So what that meant was the existing infrastructures within the business, the framework for safety, was then activated. So health and wellbeing wasn't seen as an outlier. It was one of their critical risks. So that means budgets. It means policies and procedures. It means KPIs. So there's that flicking of the switch from leadership has been important. The second part, moving on from once they'd identified it as a critical risk, they had a structure that has critical risk working groups. So a working group is made up of a diverse range of people from across the business because they're using the safety infrastructure. The systems were able to use things like ratios, so they were able to identify in the program a certain role that needed to be played, and they'll say 1 in 100 will do that. This is a large workplace, so we're well over 3,000 employees. So they were able to use those ratios and that infrastructure. They're able to define the parameters for inclusion, and they took a whole-of-person approach to that. So that may have been partly OzHelp's influence, but whole-of-person approach to health and wellbeing means incorporated mental health, physical health, sleep and fatigue. It wasn't isolating one area. It was really looking at the whole of person. We're also able to define the critical risk working group define the metrics, so how they measure success. Now, I'll go straight in, if you like. Sorry, the first step before we go through how they rolled out was to advertise and recruit internally for, and we'll call them ambassadors. They're actually called something else in this workplace, but call them ambassadors. So if you have a look at the rollout schedule, I'll just run through it. So after the critical risk working group did the groundwork, identified ambassadors internally. They then briefed senior management on the program, then briefed regional leaders on their role in the program and what was happening. So that's your site managers, your state managers, etc. Then the linchpin of the whole program was training ambassadors. So they became the key to all things wellbeing. Key being able to roll out. So the ambassador training was, I'll just flick forward one, was quite comprehensive, and the ambassador program introduced them to the program, gave them the skills and knowledge to play their role as an ambassador. So for example, they needed a skill around particularly mental health, which can be a difficult area to have conversations around. So they needed to identify, to respond, and refer. So a one-day training incorporated a significant amount of that. They were then skilled in being able to deliver particular training. So what that meant was, so they licensed particular modules of training to be able to deliver themselves. That meant that they had a dynamic delivery capability. Example, on wet days, they could do a wellbeing at work, which is a 10-minute introduction to wellbeing where people identify action items. For example, that was one of the programs. Or a 45-minute mental health awareness session. So it's quite innovative in that the company licensed that and we trained them to be able to deliver. So on a wet day, they didn't have to schedule, organise outside service providers, etc. It made it quite a dynamic environment. We also equipped them to be able to roll out the upcoming programs, including the health and wellbeing screening program, and introduce them to ambassador support. So what that meant was the people who the people who trained them in these skills, they then had access to them ongoing in a mentoring role. So you can see there on that schedule down the bottom, and ambassador support is provided by OzHelp, by the people they train to the ambassadors. So then we went through to, you'll see the next phase of the rollout was to the entire workforce. So, and it was rolled out using their internal structures. So the workplace tune-up program is an OzHelp program, a health and wellbeing screening tool, incorporates in-person coaching support, but is completed in an online format. So they rolled that out to the whole workforce. They had the capability for the two trainings, so the mental health awareness plus the wellbeing at work. So that's an important distinction, being that there was a proactive, positive wellbeing focus as well as a response capability within this model. So then the wellbeing at work online, which backs up obviously the wellbeing at work face-to-face, but is completed in an online format. And the whole workforce was receiving follow-up coaching support based on their results to their tune-up, to their health and wellbeing screening. So the nature of that support might be explaining what a diabetes risk assessment, that someone's, come back as a high diabetes risk based on the OzD risk assessment. Do they know what that means? Do they know what steps they can take to reduce that risk? And then being available as a coach. And finally, reporting back on the benchmark data. So the important things to note here, I think, integrated with their existing EAP. So that's not what this is. The support would potentially be referring people into an EAP, but certainly not what it is. So I'll flick through to just get you to, I'll ask you a question just for you to think about. So where does your activity fit in on the continuum that's displayed here? So this is not a bad to good continuum. So if you think though that best practice is on the right hand side and developing is on the left hand side, and I would have put a few examples of activity, so training activity, EAP, and where that fits in with embedded, being measurable. So some of the things we'll start to look at now. So it's not a bad to good, it's just so you can start to look, okay, we're doing that, I see that it's got a way to go. So I'll give you two examples later on of how workplaces who are very much in the middle of this continuum, so consumed in activity, but how they're able to use some data to move towards gaining some resources to being closer to best practice. And just look at it in terms of, if you're doing training, are you doing training on something that you're measuring? And start to think in those ways, because then you can build some powerful business case. So I believe there's always opportunities to progress, and that's our role to sort of provide you with the tools to do that. So instead of me perhaps telling you about why I think that example exemplifies some best practice, just go through the research. There's quite a bit of it out there, but Comcare have done a lot of work on it. They've released an extensive review of the literature, which identified the elements that were present for best practice in corporate wellness programs. So these were active support and participation by senior leadership. Now I can't stress how important this is. What we see in the marketplace is two different types of engagement by senior leadership. So one is where usually this is in bigger corporations and organisations, there's an acknowledgement of health and wellbeing is important, or whatever, corporate wellness, whatever the terminology you choose. And they employ personnel, or in their language, they'll assign resources. They'll employ personnel to look after the health and wellbeing of the organisation, and they'll call that active support. So they would look at that and say tick. And many of you may operate in this environment, and what it's characterised by is having to operate outside of team structures, typically with little authority to direct activity. Sometimes people have said it's like begging people to come to courses or training. So it's characterised, you'll see it as what you're doing is separate to the day-to-day business of the organisation. So on that continuum, we look at it and say, yeah, that's not embedded. So yes, it is active support and participation to a degree, but look on the other hand, and look at our case study where there's a group of employers who are truly supporting and participating, and I believe that the case study sort of that was a key part in launching that program. So workplace health and well-being, workplace health as a shared responsibility. So how this is embodied in the best organisation is that it's a shared responsibility between employers and employees. So the workplace is not responsible for an individual's health. It's an important distinction to make. But they provide an environment that impacts a person's health. So that can be either provide an environment that empowers employees to take responsibility for their own health and well-being. And again, I would argue that the case study provided a lot of tools for that. So this is partly why I believe it's important to consider the impact of workplace practices when you're dealing with health and well-being. So it helps things become embedded, helps understand that one of the biggest impacts we can have is through our actual workplace practices. So talk about that more with some of the research coming up. So engage key stakeholders. Well, that's pretty much necessary for any successful program, health and wellbeing, or anything. So participatory planning and design, they identified. So this is often misunderstood. It's an area that people get bogged down in. For example, they go around and say to the workplace, what do you want to do as part of your wellbeing program in order to get engagement, the big E? And the answer might come back, free gym membership. So that may not be affordable for your workplace. It might not even be on the table. So the whole exercise can become counterproductive. It's like, why ask? So you and doing that also, even if it's not as obvious as that example, you end up with a wants-based program rather than a needs-based program. So employees are unlikely to request a diabetes risk assessment and to have personal coaching about what they can do about that. Whereas a needs-based assessment may identify this as an issue, and it can then be targeted. But there's innovative ways to do that. For example, in the case study, that organisation incorporated the wellbeing at work online. So from that program, we can see the top 5, top 10 action items for all the individuals within that workplace around their wellbeing, and target it around that, combined with the actual health data. So where sugar sweetened drinks is way above benchmark, consumption of sugar sweetened drinks, for example, in that demographic can often be a problem. So it can, to get to the next one, the targeted health interventions, that's basically saying have the most positive impact that you can. So an example of a targeted workplace health intervention would be a smoking cessation program. But the only way to achieve maximum impact is to know what you need to target, and for that you need data. So an example from the transport industry would be, after completing our screening tool, the workplace tune-up, 40% of their workforce were not eating breakfast, so that was impacting on other areas of health. So they were able to take action to target that particular area, so get the biggest bang for their buck. But to do that, you need data. High levels of program engagement. So this is the big E, if you like. So this says that best practice. If it's best practice, there are high levels of engagement present in the program. But doesn't really offer. There's not much around to really offer any strategies on how to achieve a high level of engagement in the health and wellbeing space. It's almost like if you already have an engaged workforce, then you'll have a high engagement with your health and wellbeing program. So you would have noticed in the case study, the leadership set a policy setting that made engagement almost a moot point, because it was embedded as a critical risk. So for example, do you have a problem getting engagement for asbestos training where it's required? Do you have for those safety issues? No, it's a part of working at your organisation. And it's coming to an employee health and wellbeing role from a safety perspective can be a big advantage if you start to apply some of that logic. So the other example in the case study was there's your own health and wellbeing coach involved in it. Works funded that. So that case study, obviously that was in the construction industry, so they were funded by the federal government for OzHelp to come and do that, and that's our programs are. So the cost you might have been looking at the level of activity in that program, thinking that's out of our cost range. Well, actually, the federal government picked up the predominant most of the tab, so because they're in one of our funded industries. So engagement levels they're actually a lag indicator. So there's a big body of work from an organisation called AltusQ. So by lag indicator, it means you can do engagement. So by lag indicator, it means you can do engagement surveys, etc., and it will show whether your engagement is high or low. And the lead indicator for that is actually the skills of managers and leadership. So the communication and leadership skills, particularly at team leader level. That's the lead indicator for engagement. So this is where it crosses over into other areas. So where we run into engagement problems, it's a big issue. So the other area there's a specific body of work around the uptake of suicide prevention programs within workplaces, and that's conducted internally by OzHelp or by the University of Wollongong Graduate School of Medicine for OzHelp, which recognises the organisation's preparedness for an intervention. So it's a really big area, but really think about that safety structure as a power that you have to potentially leverage. So the next one is innovative marketing and sorry, I'm just having a computer problem. Sorry, the next innovative marketing and communications. In our case study, there was some innovation around getting ambassador on board, but then utilising normal team communication structures, other structures, so it's not an outlying issue. Evaluation and monitoring. Obviously, in our example, the baseline data can then inform what activity will be undertaken, so what training, and via hard hat chats, toolbox talks in your workplace. There might be start of a team meeting, etc. So commitment to ethical business practices, so that's around things such as privacy. It's also not asking people as part of your business to do things that they're not ethically comfortable with. And is sustainable. I mean, what this really means is that corporate wellness procedures aren't a standalone programs, but they are a part of the day-to-day business. So these are indicators of what's present under the Comcare stuff in programs that embody best practice, but not necessarily much there on how to achieve that. So move on to some body of work by the World Health Organization. And as you look through this, you'll start to see some themes. So they've developed a model for a healthy workplace. It describes 5 key areas. Leadership commitment and engagement, workers and their representatives are actively involved, and you can see where that would be as part of the critical risk group in the example we gave. Business ethics and legality again, a systematic approach, really refers to evaluation again, and data, and sustainability and integration. You start to see why the right-hand side of that continuum were what I consider optimal performance, if you like. Another specific body of work from the Mental Health Commission, and a lot of you might be familiar with this, but the conclusion found in this study are specifically around the impacts of workplace practices on employees' mental health. It was found that the following 5 domains need to be addressed by workplaces to maximise health and wellbeing. So positive culture, input into job design, into their work, how they organise it, flexibility, sense of purpose, having and knowing what their purpose is and believing in that is a really powerful, positive wellbeing, a positive role work can play in mental health, and clarity of role, clarity of tasks. So basically, one of the best things you can do for the welfare of your people when you look at this is to actually be good at your business. If you're managing things properly, then all of that stuff is not necessarily to do with a wellbeing program. It's to do with being at work. And you'll see the study that I'll just get to in a minute from the Institute of International Institute of Wellness that covers that as well. So yeah, one of the best things we can do is to be good at managing people. So that's why, for example, in the workplace tune-up, it includes a workplace section. So it's based on this research and seeks to measure the impacts of workplace practices, specifically in relation to your employees' mental health. So I think there's some advantages too of looking at what the peak bodies in this space, so like the HR industry, the RE, they have awards. They're quite comprehensive in their criteria, and I think that they're not a bad way to judge your own performance, whether you're actually going for an award or whether you just look at what constitutes, optimal performance, optimal practice. So they go through employee engagement, so no good running programs that no one actually participates in. Employee wellbeing. I'll talk about employee wellbeing and the measurement of outcomes, but positive psychology approach as well is one of their criteria for who they give their prizes to, their awards. Impact in the wider community. So I'd argue in a workplace that's actually not that hard if you're impacting your workers in a positive way. That's definitely going to flow on to their private lives, their families. Innovative delivery and innovative design, impact, measurement of outcomes, strategic business alignment, and sustainability. So of those, I think with regard to employee well-being and measurement, if you want to measure well-being in a workplace, you have to use a scale that will be sensitive to the types of intervention that a workplace can provide. So that's why the workplace tune-up, for example, utilises a scale from the UK. It's not just a depression and anxiety scale. You want to be dealing with the whole population, a well population, not just looking for those specific things. And you need the measurement scale to be able to measure. So again, you see here that from the RE stuff that measurement is important to well-being, but they don't really give guidance as to how to conduct those meaningful measurements. And again, I see that that is where OzHelp fills that gap in the marketplace, if you like. I've got a couple of questions there. I'll take them on. I'll take them online and contact you if that's okay, guys, with those questions. I'm just concerned with time. So, so one of the last pieces we'll look at before we get on to another little case study, but is the Global Wellness Institute that I mentioned and an article in Forbes. So of those two publications, the future of workplace wellness, that top one, I'd really focus on that. So workplace wellness programs as we know them will disappear. So the reason for this, and this may sort of touch on some of the questions that have been put forward, the reasons for this is because as wellbeing programs move into the mainstream, there won't be a need for a separate wellbeing program. So as safety went 20 years ago, wellbeing will be in the future. That's what on that continuum we're talking about being embedded, what the previous slide was referring to as sustainability. You know, you can see now where safety has a seat at the table with regard to every part of the business and projects and planning and budget. And it's we're just only starting to see that health and wellbeing is coming into that sphere. So in other words, the better we get at this, the less we'll need separate programs. So the second one there is also interesting, that employee wellbeing will be a metric of success. So there'll be a KPI around wellbeing of your people. So you can see that in the case study as well, but I'd really then go back to make sure it's a very difficult thing to quantify and measure, and it's not all to do with work, as we know. So individuals take more responsibility for their own wellness in the context of work. Companies must adopt a culture of wellness as a default, not the exception. Again, being embedded. If they want to attract and retain good people, companies will recognise that doing right by employees and the community is good business. Governments will become more aggressive about mandating wellness, including the workplace. Now, we're already seeing that. So, for example, OzHelp are funded by the federal government to deliver these programs within high risk, what they define as high risk industries. So The program's obviously available to everyone, but it's heavily subsidised by the federal government for certain industries. So the healthiest workplaces will be a destination where people go to improve their wellness. So, okay, so I've sort of changed tack now and talk a little bit about the power of data. So I'll use an example. In front of you there is a case study from two companies. On the one on the right is a utilities company. The one on the left is actually a government department. Now they've done the same tool. So these two organisations are very much not really necessarily reflecting best practice in the way that case study was. They're very much on the activity part. So they're doing things, they're not necessarily doing things that are informed by need or targeted to what the data says it should be. They're not necessarily embodying all the aspects of best practice, but they're still able to undertake activity. And I'll just point out the importance of data, but also benchmarking that data, because raw data, so you're looking there at two sets of data for the same things. Now, if you were just looking at the data, you wouldn't necessarily know, is that meaningful? Is that significant? Is that better than other places or worse? So that's why our workplace tune-up report is benchmarked against other workplaces. So you get an idea, okay, 85% of employees feel that there are effective procedures in place for them to raise issues and concerns about their workplace. So how does that sit? And they can see that that's good. The other organisations were below benchmark on 10 out of 11. So that then meant that the activities they undertake in health and wellbeing, although they've done the same baseline program, the backbone of it being the workplace tune-up. And by the way, if you want a full report for that, you can just jump on a sample report. You can get that from OzHelpConnect.org.au, and just we'll send one through so you can have a look at a basic report. So that was able to inform the company on the right, and in terms of what activity they undertook. So it was very clear that their figures around nutrition, particularly in that instance, around alcohol consumption. So although they knew the recommended, the behaviours were way above. Now the other workplace was able to use the data as leverage to get resources for a particular network that they were putting in place. So they were able to secure that. So it's the same programs, but a different schedule of rollout and what topics were covered, because it was needs and data driven. So these correlations, I think, I'll click through. So you've got raw data, you've got benchmarked data, then you've got data analytics. So the real power of data can then come in generating correlations. So I think these sorts of correlations give practitioners in the space, which I'm assuming a lot of you are, an opportunity to build a business case and secure resources. So that's why we try to build this capability into the programs we design. So for example, I mean, some analytics behind the data might show that people with a below average wellbeing score are 3 times more likely to be actively looking for other jobs. Now that can be helpful for you. That can be helpful for you to justify, to direct. And that's an actual figure, by the way, coming out of the workplace tune-up. Employees with above average wellbeing scores are 31% more likely to be fully committed to their team. 13% of employees are in distress right now. It's actually looking like more than that. It's been a while since I've run that analytics. 2 in 10 employees experience decreased productivity as a result of their personal wellbeing. That comes from having a productivity measure within the SPS 6, which is the Stanford Presenteeism scale, is embedded within the workplace tune-up. So you can start to have a look at those sorts of things as linked to productivity. And employees with flexible working hours to fit their life are twice as likely to have an above average wellbeing score. I mean, some of it you might think is obvious, but some of it isn't. And it throws up some really interesting things for us as practitioners to be able to use. So that's, as I said at the start, I see the role for OzHelp and OzHelp programs is to empower you to look after your workers and create a workplace where people can thrive. That's really my passion. I hope that we've had some some insights. I'd really stress too that you just think about moving your activities a little bit towards best practice or best. So I just got a question there about the web address. So it was ozhelpconnect.org.au. And we'll just send that out. So ozhelpconnect.org.au. And there was a question there also about the benchmarks. Yes, so that's right. So we can make them industry specific. So as more people go through the program, that becomes more and more powerful because there's more and more data. So the benchmarks, as this is a reasonably newly funded program, so you're right. But some of the benchmarks are live, so they're from health data, population-wide health data like smoking rates, etc. But some of them benchmarks are to do with industry specific. So really good point. The construction example did include contractors, so they include contractors in their training, etc. So they're very inclusive in that respect, and it's not just certainly not office-based personnel. That's out in the trenches. So thanks for the question there. I'll throw it open to questions. It's a bit hard to see here. They go. There's only one pop up at a time, so they disappear pretty quick. So I will go back through them and make sure I'll contact you with any answers, because obviously there's a conversation to be had way beyond what we've had here. But just a couple of questions to leave you with. What if you can ask yourself, what would be happening in your workplace if you were embodying best practice? How much of this would be happening already? And where does the activity for your workplace fit into that continuum? And how can you take little steps towards the right, if you like, towards being embedded, towards utilising existing structures, towards measuring outcomes? I've got a question. If asking people what they want for well-being gets free gym membership, what is a better strategy for employee participation? So that's the big E, I guess, is there's not one necessary single answer for that, but certainly where it's embedded, and in the example I gave, it wasn't there was a carrot and stick there, so there's something in it for the employees to participate, but it's also what's done. It announces to someone, if you work here, this is how we do it. This is our culture. It includes this. It's not it's a critical risk for us, your health. So it becomes, so another strategy is as I was alluding to, is to utilize those structures and have health and well-being embedded in the day-to-day business of the workplace, rather than a separate thing that's not connected to the day-to-day work. But that's the big question. What I'll do, I'll just leave that up on the board. But there's learnings there from OzHelp over the years. I'll leave that there, and I'll probably throw it open, and if I can spot a question, if it stays up long enough, I'll try and answer it. But rest assured. So I've got a question here from Wayne. Sorry, I know that you asked a question earlier as well, so I'll go back to that. But will we receive a copy of the presentation? So the answer is yes, that's available, even for people, I think, that registered but couldn't come on. So I think it's a 4-day lag, and that'll be sent out. But you can certainly contact SIA, Safety Institute, for that. So before I forget, I'll actually again thank the SIA and thank for the opportunity, and thank you for attending. So, are there any other questions that asking general engagement ones are really hard without knowing industry and everything, but I can certainly give you a ton of examples of how there's always opportunities to be smart around this stuff, and I'm happy to talk to anyone about what we've done in whatever industry. That's really where we come from. We've done the hard yards with engagement. So we've literally engaged with the hardest demographic, and hopefully definitely that learning has gone into our programs. So I might throw back to might ask Bianca, if you're on the line, if you want to come back on.
Yes, thank you, James, for your presentation, and thank you to everyone for attending the webinar. If you could please stay logged in to take our online survey, which you will be redirected. If you could please stay logged in to take our online survey, which you will be redirected to shortly. We thank you in advance for your feedback and wish you a pleasant afternoon.
Thank you.